What has me most anxious about the changes that are coming from, or the proposed changes that are coming from the federal government with respect to Medicaid cuts, the elimination of SNAP benefits, is that your communities start to perish. Access to care goes away. You already have organizations that are talking about and contemplating layoffs or service eliminations, where we're already in areas where access to care is a challenge.
And I'm deeply concerned that the impact of this is going to be a lack of access to these individuals, crowded emergency departments. There will be individuals coming to hospital with sicker and more complex conditions that will require additional dollars and more services. How we prevented the emotional impact that this has created, especially with the presence of ICE in our community, depression, mental health issues related to that.
Many more will suffer, many more will die. And there's no reason why that has to occur. Not when you've got mechanisms and strategies and people in place to create a better quality of life, to give folks a good chance at living and being able to do so for many, many generations to come. So if you've got a strategy, if you've got a model like this model with Collaborative Bridges that's working, what you want to do is find a way to continue to feed that effort, not to starve it.
If the federal dollars, the federal Medicaid dollars are reduced, the state will now have some interesting choices before it. You can either lessen the number of people that are covered, or you can cut the amount of services for the same amount of people. Either way, those changes to a safety net like Sinai will result in fewer dollars coming in, despite that work and everything still needing to be done.
We think that as a result of this, the number of uninsured in this country will rise to 40 million. This is a number that's not been seen since before the Affordable Care Act, which means 40,000 to probably 100,000 people could die each year of being uninsured. That's unacceptable in the richest country in the world.
And the more funding is pulled from us, the more healthcare workers are bridging gaps and just working over